Organ transplants. How science and compassion. Every day, thousands of lives hang in the balance. People with failing hearts, kidneys, or livers wait for a miracle. That miracle comes in the form of organ transplants, a medical marvel that combines science, technology, and human compassion. What is organ transplantation? Organ removal and transplant. Organ transplantation is the surgical replacement of a diseased organ with a healthy one. It is life-saving for patients with end-stage organ failure, including kidneys, liver, heart, lungs, and pancreas. Dr. Martinez, 50s. Kidney and liver transplants are the most common, but even heart and lung transplants are now routine in specialized centers. Success depends on careful matching between donor and recipient, surgical skill, and post-operative care. The first successful human kidney transplant was performed in 1954 between identical twins. This breakthrough proved that organ replacement could save lives if immune rejection was carefully managed. The science behind transplants. One of the biggest challenges in transplantation is the body's immune system. It naturally attacks anything recognized as foreign, a process called rejection. Acute rejection is usually T-cell mediated, while chronic rejection develops over months or years. To prevent this, doctors prescribe immunosuppressive drugs. While essential, these medications increase the risk of infections and other complications. Dr. Martinez's modern immunosuppressive therapy has revolutionized transplant outcomes. Patients now have survival rates exceeding 80% for kidney and liver transplants over 5 years. 5-year survival rates: kidney 85%, liver 75 to 80%, heart 70%. Organ preservation techniques, such as hypothermic and normothermic perfusion, extend the viability of donated organs and reduce damage before transplantation. Donors and ethics. Organs come from two sources: living donors and deceased donors. Living donors often donate a kidney or part of their liver. Deceased donors are usually brain-dead patients whose families consent to organ donation. Grace: losing my son was the hardest thing in my life. But knowing his organs saved several lives, it gave meaning to his death. Ethical frameworks govern organ donation to ensure informed consent, fairness, and transparency. Brain death criteria are legally defined, allowing donations while respecting the dignity of the donor. Ethical considerations, consent, fair allocation, transparency, real-life stories. Let's follow Emma, a 35-year-old mother whose liver failed due to chronic disease. Her survival depended on a liver from a compatible donor. Emma's donor liver arrived just in time. The surgery was successful, and today she's alive, walking, and enjoying life with her family. Grace. Knowing my son's organs saved Emma, I feel a piece of him still lives. Stories like Emma's highlight the human side of organ transplantation. Science saves lives, but compassion makes it possible. Challenges and future directions. Despite medical advancements, organ transplantation faces significant challenges. Demand far exceeds supply, leading to long waiting lists. Chronic rejection, infections, and post-operative complications also impact survival. Researchers are exploring stem cell therapies, xenotransplantation, and 3D printed organs to reduce dependency on donor organs. These innovations could transform transplantation in the next decade. Public awareness and donor registration remain critical. Thousands of lives could be saved each year if more people became donors. Conclusion. Organ transplantation is a perfect blend of science, ethics, and human compassion. Behind every transplant is a story of hope, courage, and generosity. Dr. Martinez, if you register as an organ donor, you could give someone a second chance at life. Every organ, every donation, matters. Organ donor today. Save lives. Science can replace a failing organ. Compassion makes that science meaningful. Together, they save lives. And remember, one decision can save multiple lives. Subscribe for more medical insights. Share to save lives.